You are good to go.
Okay, I am Kat Hayes. I am the recovery specialist for the McLean County ROSC.
Wonderful. Thanks, Kat. All right, Alan.
Hello, I'm Alan Reed, and I'm a part-time, what do we call a residential tech at Chestnut, and I'm just more or less visiting and observing. It's nice to meet you guys.
Thanks for being here today, Alan. All righty, Barb.
Hi, I'm Barb Brumlevy, and I'm a community health specialist here at Chestnut, and I work on the McLean County, Ford County, and Livingston County ROSCs.
Thanks,
Happy
Barb.
to be here. Thanks.
Awesome. Jonathan.
Hi, my name is Jonathan Baptist. Today is my second day at Chestnut. I'm the community health specialist, and I'm working with the Be In Parents project.
Welcome, Jonathan. We're excited to have you on here today.
Thank you.
All righty, Michelle.
I'm Michelle Cope with the Bloomington Public Library. It's nice to see everybody.
Good to have you on here today, Michelle. Thank you. All right, Joanna.
Oh, let me get off mute. I'm Joanna Gonzalez. I work for the Illinois Department of Human Services, Substance Use Prevention and Recovery Program, and I oversee all of the Illinois ROSC. So it's really nice to be here. Thank you for the invite. I know I've been pushing for these invites, but I definitely want to be here, and I want to hear what you guys are doing and report back all these amazing things that are happening that, of course, our department doesn't get to hear. So I'm really happy to be here.
Wonderful. Thank you for being here, Joanna. We greatly appreciate you taking some time out of your busy schedule as well. So it's a pleasure to have you on. All righty, Randy.
Hi, I'm Randy Derrick. I'm a prevention coordinator also at Chestnut Health Systems with the Be In Parents Project, the Substance Use Prevention Coalition for Bloomington Normal. I'm also the Narcan provider for McLean County. So you can reach out to me if you want training or just replenish your supply of Narcan.
Thank you, Randy. And we'll be learning a little bit more about Narcan in today's presentation today. So I'm excited to share that information with you. All right, Selena.
Hi, my name is Selena Pappas. I am the Bloomington and Rural Health Outreach.
Great, thank you so much. All right, Nicole Davidson.
Hi, I'm Nicole Davidson. I work with TASK and I work with the Corrections Division program. So we work with clients who are on parole.
Wonderful. Thank you so much for being here. All right, Sarah.
Hi, everyone. My name is Sarah Stalter. I'm the Assistant Director with the County's Behavioral Health Coordination Department and also a recovery specialist.
Wonderful. Thank you so much. All right, Damika.
Hi, everybody. I'm Damika Kirkwood, and I'm with Prairie State Legal Services, and I am their community outreach specialist.
Great. Thank you so much, Damika. It's a pleasure to have you on. All righty, Erica.
Hi, I'm Erica from Omni Youth Services. I'm a prevention specialist and I work under the state opioid response grant. So I try to do education awareness on fentanyl, xylazine, and proper use of prescription medication.
Awesome. Thank you, Erica. Tasha Davis.
Hello, I'm Tasha Davis. I'm with Family Community Resource Center. I am the Family Enhancement Specialist and I also work in outreach.
Awesome. Thank you, Tasha. Alrighty, I have Vitali. I apologize if I'm pronouncing your name wrong.
No, you said it just as it's meant to be. So you get a gold star for the day. I'm Vitali. I was invited by Michelle to attend this meeting. I actually work in energy efficiency, and I manage a program available to folks in Bloomington Normal that aims to help folks save money on their energy bills and lower their energy burden. So I'm just here to network with y'all, wonderful people, and share this resource and learn more about what all of you do. Thanks.
Wonderful. It's a pleasure to have you on today. Thank you so much for joining us.
Yeah, I'm so glad. Thanks.
Awesome. Alrighty, Lakeisha. Alrighty, Lakeisha put her contact information and title in the chat. So she's the Resident Services Coordinator at the Bloomington Housing Authority. Thank you, Lakeisha. It's great to have you here. All right, Leanne.
Yeah, Hi, everyone. Good afternoon. My name is Leanne Corson, and I am the Region 3 ROSC mentor. So I just support all the ROSC councils that are in Region 3, and I'm happy to be here with you guys today.
Wonderful. Thank you, Leanne. All right. And last but not least, we have Marisa.
Hi, everyone. My name is Marisa. I'm basically with McLean County CASA. I am a CASA advocate, CASA case supervisor, essentially. So yeah, that's me.
Okay, wonderful. Thank you so much all for being here. We are excited for our May council meeting. It is hard to believe that it's already May. The spring is absolutely flying by, but we have a really awesome presentation for you today, and I feel very blessed to be able to share some of this information with you. So I'm going to be able to pull up my screen here and get this sharing. Alrighty, is everyone able to see that okay? Okay, fantastic. Sounds great. So again, today we are really going to take a dive into understanding substance use and what that looks like within McLean County, but also taking a dive into what has the community's response been to substance use. We oftentimes know that substance use has been a crisis, not only in our nation and our state and our community for some time, but we thought it would be important just to take some time out of our meeting today to reflect on all the incredible work that has happened and is continuing to happen in McLean County. So we're really going to start off our conversation by taking a look at what addiction is, understanding substance use as it pertains to some of the medical definitions that we know and we hear of. But then we're also going to take a look at some national, state, and local data, and then really diving into, again, what the community is doing around substance use. I recognize in the short amount of time that we have set aside for this presentation, that's just not enough time to be able to highlight every single agency and organization that does work around substance use. But first and foremost, we hopefully today will just serve as a reminder of the great work that is happening and provide some of the key highlights and initiatives. At the very end, we will be providing some more contact information. Each and every one of you are welcome to reach out to me directly. If you'd like to set up a meeting to discuss this information in greater detail, I would love to meet with you and connect and answer any other questions that you might have. At any point, if you have any questions within the presentation, feel free to either raise your hand, put those questions in the chat, or either unmute yourself and ask that question at that time. Again, if time does not allow for multiple questions and answers, I would be more than happy to connect with you afterwards. All right, so moving into our first slide today, I really want you guys to understand and remember that addiction is a treatable chronic brain disease. And very similar to how diabetes is a chronic disease that affects the pancreas, addiction is a chronic disease that affects the brain. You know, diabetes nor addiction mean that there is a character flaw or a moral failing or even a choice, right? We know that while it cannot necessarily be cured, addiction can be treated and people do learn to manage it. Another thing to keep in mind today as we move forward is that addiction really takes over parts of the brain, including the motivation and your reward system. Now, what that specifically looks like, right, is that it plays an effect on the brain that allows for you to reason and weigh the consequences of your choices. So ultimately, it changes the wiring of the brain and tells the person that their survival is really dependent upon using again. Now, we know addiction affects millions of Americans, and it's likely that many of you know someone living with a substance use disorder. So according to the Substance Abuse and Mental Health Services Association, also known as SAMHSA, an estimated 20 million Americans aged 12 or older have a substance use disorder related to their use of alcohol or illicit drugs. And approximately 14.8 million Americans have an alcohol use disorder. Looking at that last statistic that we see on our screen, 8.1 million Americans have an illicit drug use disorder. And so that is some pretty alarming statistics. So when we take a moment to really reflect on why we meet each and every month and all the wonderful work that's happening in our community, these statistics show that there are so many people that are needing substance use services and supports. When we take a deeper dive into addiction statistics within the United States, we oftentimes hear and see that opioids are a large part of the problem. Opioids, by definition, are a broad group of pain relieving drugs that work by interacting with the opioid receptors in one's cells. Much of the alarming increase in opioid overdose deaths in recent years can be attributed to the rise of dangerous synthetic opioids, such as fentanyl. Synthetic opioids are fast acting and can be hundreds to thousands of times more toxic than heroin. Heroin or other street drugs are often mixed with fentanyl to increase their effects, which can quickly become a lethal combination. When we take a look at the CDC's data that you see up here on our screen, the opioid epidemic has really come in three different waves, if you will. The first is we see the rise in prescription opioid overdoses. Then we see the rise in heroin overdoses. And again, that third rise that you see has been in synthetic opioid overdoses. So fentanyl and other synthetic opioids have really been the driving crisis in recent years, with an increasing share of the supply coming directly from Mexico. The COVID-19 pandemic has exacerbated this crisis with reported spikes in overdose deaths really across our nation. We know that the CDC's Injury Center looks at deaths and non-fatal overdoses of 4 major categories of opioids, and I plan just to provide you a quick overview of what that specifically looks like. The first category is our natural opioids. So that includes things like morphine and codeine, and semi-synthetic opioids such as oxycodone and hydrocodone. Then we see that the second category is methadone, which is a synthetic opioid. And then we also have other synthetic opioids other than methadone, drugs like tramadol and fentanyl. And the fourth category would be heroin, which is an illicit, illegally made opioid synthesized from morphine that can either be a white or brown powder or a black sticky substance. Alrighty, so as we take a look as to what does substance use look like in the state of Illinois, right? The numbers are still quite alarming. Overall, in 2020, there were 2.3 times more opioid deaths than car crashes, and 2.2 times more opioid deaths than homicides. Again, synthetic opioids such as fentanyl can be attributed to the increase in number of fatalities. And a shocking statistic to share with you today is since 2013, synthetic opioid deaths in Illinois have increased by nearly 3,000%. Right. And so all of this data is gathered from the Illinois Department of Public Health. And this is all available for you to do your own research on as well if you visit their website. But these are just a few statistics from the state of Illinois that are quite alarming and again remind us why we do what we do. So taking a deeper dive into McLean County specific adult substance use data, right? We see that this is a problem across our nation, across our state, but what do these numbers specifically look like for our community? I first want to start off by saying that the information you see on this screen is not a complete data set. And what that specifically means is that, overall, due to limitations with data collection, that can mean variations in reporting methods, toxicology reports, overdoses that are not directly reported, variations in classification processes. All of that can kind of give us different data across different websites and data collection methods. So what I have up in here on the screen are just a few different substance use data points that I have been able to pull and share with you today. But again, I want you to recognize that this isn't a full scope as to what is exactly happening in our community. So the first statistic that you see up there is that in 2022, there were approximately 71 opioid-related specific emergency department cases. So this includes things like your heroin, codeine, methadone, hydrocodone, fentanyl, morphine, etc. Taking a look at 2022 and 2021 McLean County coroner data, we see that in 2022, there were approximately 25 drug-related deaths. 68% of which were male and 32% were female. And then in 2021, there were approximately 26 drug-related deaths, 81% of which were male and 19% which were female. Overall, the average age of these individuals was 42 years old. Taking a look at the McLean County EMS data in 2022, they ran approximately 46 overdose calls. And this is inclusive of all overdoses, which includes opioid overdoses, but also overdoses from alcohol, cocaine, marijuana, methamphetamines, etc. When we take a look at those numbers, 65% were male and 35% were female. Alrighty, now that we have examined adult substance use data for McLean County, we will briefly touch on what does substance use look like amongst our youth in our community. Oftentimes, youth substance use data can be evaluated through what we consider to be the Illinois Youth Survey, also known as the IYS. For the folks on this call that don't know, the IYS is a self-reported survey administered in school settings and is really designed to gather information on a wide variety of health and social indicators. So really taking a look as to what do students and youth believe about substance use? What are their perceptions about substance use? What about bullying and school climate, nutrition, and even physical activity? So as you can see up here, we're particularly taking a look at the past 30-day use, and we particularly take a look at this set of data as it shows us the most prevalent behaviors amongst adolescents. So what have their decision-making processes look like in the last 30 days? Overall, you can see that the data I pulled together for today is across alcohol use, tobacco products, marijuana, and then prescription drugs that were not prescribed to them. So all of these are self-reported statistics. And you can see that from 2018 to 2022, right, the data has decreased, which is a good thing. We want to see those numbers go down. We want to see youth reporting less substance use activity. Overall, today we are going to be talking about some services and supports available to our youth. And it's difficult to say that those are for sure the reason why these numbers have decreased over these years. But we will learn today that prevention education does in fact equip our youth with the knowledge and skills needed to make healthier decisions. So taking a look at 2022, approximately 2,600 McLean County students were surveyed. So that's across 8th, 10th, and 12th grade students. And that is 9 out of 11 middle schools and 7 out of 10 high schools. Alrighty, so now we're really gonna dive into what is our community doing to address these issues. And the best way that we can do that is by taking a look at what we consider to be the substance use continuum of care. Some of you maybe have heard of this before, but kind of putting it into a nutshell, a comprehensive substance use continuum really combines many programs, policies, practices to ultimately reduce substance use within a community. So again, the agency highlights today are not a full representation of all substance use and or mental health support services in our area, but we'll hopefully highlight some key initiatives. And we will start off our conversation by talking a little bit about substance use promotion. So when we take a look at the first part of the continuum, which is promotion, that is really defined as any type of strategy that creates an environment which allows individuals to increase control over their health, therefore improving their quality of life. So when we take a look at the substance use promotion services in McLean County, we see a wide variety of things. First and foremost, we see that the McLean County Health Department offers a wide variety of health literature, tobacco-free policies, assistance with community needs assessments, and they even provide anti-stigma efforts around substance use disorders. We also see that various community outreach services are available around emotional, behavioral, crisis, and family supports. So agencies to highlight there are the Center for Human Services, PATH Crisis Center, Project Oz, Chestnut Health Systems, Center for Youth and Family Services, and many, many more. We also see that various education opportunities are available in our community as it pertains to recovery supports. The Heartland Community College in our area offers a recovery support specialist certification. So this certification allows folks to help others develop, strengthen, and maintain their recovery from substance use and mental health disorders. We also know that there's various trainings in our community, right, around mental health first aid and trauma-informed care. Those types of trainings really equip our stakeholders with the knowledge and skills needed to care for their clients. Now, if either of anyone on this call today or anyone at your agency is interested in any type of training, you are more than welcome to reach out to our ROSC team and we can get you connected to the resources in our community. Also, we know that our McLean County ROSC, right, we promote sober social activities while also working to reduce stigma with education and awareness. So all of those activities fall apart under McLean County's response to substance use promotion. As we take a look into prevention, which is the second part of the continuum, overall prevention really encompasses any activity or strategy that's designed to either decrease or delay substance use. So as we reflect back on the numbers previously stated, we recognize that prevention plays a really crucial role in our community for preventing substance use in the first place. So taking a look at Project Oz, they are the primary substance use prevention program provider. That's a mouthful in our community, but they provide evidence-based substance use programming to 4th through 7th grade students. So that curriculum focuses on skill development, really to enhance protective factors and reduce the risk factors related to alcohol, tobacco, and other drug use. So in 2022, to give them a huge shout out, they served 8 public school districts, again, serving almost 3,000 students. So 2,893 students were served in 2022 simply through their prevention programming. Secondly, we know that multiple school districts in our community engage in yearly prevention campaigns. We oftentimes hear of Red Ribbon Week, right? That's the drug prevention campaign, which is usually held in the month of October. We also see National Prevention Week, which is held in May, but both of these really work to highlight various prevention, communication, and strategy efforts in our community. And I know we have some folks on the call today representing Bloomington Normal parents, also known as BN parents. So BN parents plans and implement strategies to prevent and reduce youth substance use and its associated consequences. BN parents really does target parents, but they also serve children kindergarten through 20 years old through their Unstoppable campaign. There's also a college branch of BN Parents titled BNCCC, and that is a group of stakeholders across local colleges that work to reduce substance use on college campuses. And lastly, as it pertains to prevention, there are National Drug Take Back Days that happen within our community. These usually happen about 2 times a year, and this is an initiative through the Drug Enforcement Agency. So really encouraging the public to remove any unneeded medications from their homes to prevent medication misuse, but also opioid addiction from ever starting in the first place. Alrighty, the third part of the continuum that we're going to discuss today is harm reduction. Harm reduction is defined as any type of strategy, policy, or program aimed at reducing the negative consequences or risky behaviors amongst persons who use drugs. So one thing to note is that many of us have actually been utilizing harm reduction for many years, and we may not even realize it. Right? We put on our seatbelt when we get into a vehicle, or some of us may put on sunscreen right before going out on a hot sunny day. Both are forms of harm reduction, and that is what we're talking about with this slide. Many of you have probably heard of the opioid reversal medication called naloxone, or commonly referred to as Narcan. So when given in an appropriate time frame, Narcan can be a truly life-saving medication and can reverse the opioid overdose. So this includes opioids such as heroin, fentanyl, and prescription opioid medications. We do know that Chestnut is the primary Narcan provider in our community, but there are other folks that are distributing Narcan as well, and we are so thankful for that partnership. But we see that there's not only trainings taking place, but we're getting more and more Narcan in the hands of folks that need it. Lastly, we see that Jolt Harm Reduction has recently started some mobile-based harm reduction programs, including safe syringe exchange, Narcan distribution, fentanyl testing, and street outreach within our community. Just to conclude with this slide, I do want to make mention that research really has shown harm reduction approaches to lead to safer use, moderation of use, but also even abstinence. And all of that really just depends on the individual's desires and needs. Because the focus of harm reduction is on improving quality of life, really any step that reduces harm to individuals, their loved ones, their community, or even their society should be embraced and celebrated. All right, the fourth part of the continuum is treatment. And we are so blessed to have a community, right, that has so many wonderful treatment providers for substance use and/or mental health disorders. When we take a look at treatment, this really includes the management and care of a patient, which oftentimes includes things like medication, counseling, or other supportive services. Again, as we take a deeper dive into McLean County's treatment services, we see that there's multiple organizations that are doing such fantastic work. We want to highlight Carl Broman, OSF, a Center for Human Services, Chestnut, and many, many more. Many of those organizations offer inpatient and/or outpatient services for substance use disorder, but also many offer medication-assisted recovery, also known as MAR services. So research has shown that the use of medications in combination with counseling and behavioral therapies can be an effective treatment for opioid use disorders and can help people sustain recovery. A large part of the treatment continuum here in McLean County, right, is highlighting what we consider to be local problem-solving courts, one of which includes our local adult drug court, which was actually established in 2008 and was the first drug court in Illinois. So this service is really a multi-organizational collaboration that focuses on offering individuals the opportunity to enter long-term drug treatment and agree to court supervision rather than receiving a jail sentence. And last but not least, a large part of the treatment continuum is crisis care, which may include services from intervention, advocacy, or peer support. Some organizations that offer these services are Path Crisis Center and McLean County Fuse, also known as the McLean County Frequent User System Engagement. And we also know that one positive aspect of the COVID-19 pandemic was the increase of access and availability of telehealth services. And we see that right here in our community as it pertains to substance use disorder treatment and supports. All right, and last but not least, we have our recovery slide. So overall recovery can be defined as a process of change, right? That removes barriers and supports individuals to reach their full potential. With the ROSC, we believe that there are multiple pathways to recovery. And when we take a look at recovery, it's important to evaluate the whole person, right? And provide them with the various wraparound services needed to live a self-directed life. So as many of you are already a part of our ROSC Council, I want to give you a huge shout out and thank you for the folks that are joining us and starting to get re-involved or are newly involved with our ROSC. It's truly because of you, right, that we can get together and make change happen as it pertains to recovery in our community. The ROSC really does strive to be a group of stakeholders that increase access and reduce barriers to creating a more recovery-oriented community. So thank you for each and every one of you for coming each and every month to support the work that we're doing. We also see that as we take a look at support groups in McLean County, there is a wide variety of support groups for substance use disorder, right? We also know that there's not only faith-based support groups, but there's also secular support groups available. And that really helps meet the needs of the specific meets the specific needs of the individual. So some meetings that are available within our community are AA or 12-step meetings, NA, Celebrate Recovery, Smart Recovery, and many more. We also know that there's various recovery homes and residencies available within McLean County, including things like Oxford Houses, Labyrinth House, House of Hope, and many more. We do know that housing, legal, transportation supports are also available in our area and play a large part in one's recovery. We see that multiple organizations are offering these types of services to ensure that barriers are being reduced, to really, again, ensure one's full potential is able to be reached. Lastly, our community offers a variety of peer recovery support services. And what that exactly looks like is peers are individuals with lived experience who offer to help others through empathy, respect, and empowerment. So research has shown that recovery is facilitated by social support, and this can be reached through services such as peer mentoring or even peer-led support groups. So as we start to wrap up this portion of our conversation today, I want to end on a positive message and share with you that recovery is not only possible, but it is a reality for approximately 23 million Americans. As much as the statistics show how much more work there is to be done, I do want to encourage each and every one of you that you play a crucial role in reducing substance use within our community. This really can be done in a wide variety of ways, but oftentimes it can start with that stigma reduction, right? We know that there's so much stigma around substance use disorders, and a large part of that starts with increasing our own awareness and education around substance use, and that is similar to what we are doing today. Also, increasing your awareness and education through trainings, right? There was various trainings provided in the beginning part of our conversation, but also if you're interested in Narcan or getting trained in Narcan or bringing that to your organization, we are happy to help support with moving that forward for you. And lastly, we just encourage you to continue your involvement with the McLean County ROSC. It's really because of you that each and every one of you have a voice, right? And you're bringing that to the table every single month. And that is what helps us drive positive recovery change in our community. So I'm going to go ahead and pause right here. If you have any questions, I would love to connect with you guys or answer any questions that maybe you have at this time. But also I will go ahead and put up that slide one more time here. There is Narcan information on there. So Randy's contact information, her email, and her phone number. If anyone would like, again, a Narcan training or would like us to deliver Narcan for your organization, Randy is a great support for that. So again, I will take a moment to pause, and if there's any specific questions, I'm more than happy to answer those at that time. I don't see any questions in the chat either.
Hello, my name is Samantha. I'm with the McLean County Fuse. So I appreciated you giving us a little shout out in your presentation. One of the clarifications that I wanted to ask about was if Chestnut is specifically providing Narcan to businesses and agencies. We've had a lot of individuals reach out, and we've been in contact with a couple of staff members from Chestnut, and it seems to be that this is really marketed towards agencies instead of actual individuals. And I know my coworker Sarah is also on here, so I know she has a very similar question. If we could just get clarification on who you're actually marketing towards, and then all that good stuff.
Yeah, that's a great question. I'm actually going to have Randy, if you don't mind, taking that question over.
Of course, yeah. So we are able to provide training or just the Narcan to individuals, organizations, anybody that might need it in the community. I will say Jolt harm reduction did just start here within the past month. They might be more appropriate for individuals using certain types of substances, just because they can provide those syringe service access programs as well as that door-to-door support. I am also the Substance Use Prevention Coalition, so I do not have like immediate action that I can go out and do those things. It's usually about a 24-hour turnaround time. So it's me and Jolt, but you can definitely get in contact with me, and I text with Jolt once a week or more. So we can definitely get it to anybody that needs it in the county.
And so I think that again goes into the question of, because we have a very strong relationship with Jolt, and we've talked with Jolt a lot about individual Narcan. So it sounds like Chestnut's main goal is to get the Narcan towards the agencies and then utilizing Jolt for individuals.
That's kind of the relationship that we have right now. We are able to give it to individuals though, if that was an identified need. So you can definitely contact with us, or we can, if somebody comes to your organization, we can give you a case of Narcan and you can give it in that moment if that is an identified need that you have.
Okie dokie. Thank you very much.
Yeah, so yeah, you can get in contact with me. My email's right there, and we can definitely meet about that and see, because we definitely want to reduce those barriers, because if they need it in that moment, we want them to get it then.
Thank you.
Thank you, Sam. That's a great question. Any other questions or thoughts or anything that needs clarification before we move on to the second half of our presentation? Okay, I think we're good for right now. Again, the door is always open. Anyone is welcome to reach out to me directly if you'd like to set up a meeting and talk a little bit more. I would be more than happy to meet with you. All right, we will dive right on into our next slide. So we just want to take a quick moment to highlight our professional clothing drive, which took place in April. And when we say the community came together, we truly meant that the community came together for this initiative. I don't think our team was quite prepared for the community outpour of donations for this initiative. So we just want to take a moment as a team to say thank you. We recognize that there are multiple folks on this call that not only donated clothing, but also helped with the actual collection drive itself, right? So LifeSil, Center for Human Services, ISU Campus Police, but also our Chestnut MLK residential space, they were all collection sites. And so we greatly appreciate for everyone involved for your donations, your support, your awareness with collecting these professional clothing. So with that being said, these clothings has kind of gone in a couple different directions. We did a May Day clothes swap with Dreams Are Possible at the end of April, and that was a success, opening up the doors for low-income individuals to be able to come and gather any type of clothing that they may need completely free of charge. Now, the second half of our donations has been set up at the Glen Covert building, which is over at our Chestnut residential location. And the doors have been open for all of our inpatient and outpatient clients over at Chestnut. So they have been able to come through and collect any type of clothing that maybe they are looking for or needing. And that has been a huge blessing for many people. So we are excited to hear of the continued outpour and support and the impact that we know that these clothes are going to continue to make. So with this being said, we still have an abundance of donations that need to be collected and taken off of our hands. So we are opening up our clothing drive this Thursday, which is May 18th, from 1 to 4 p.m. at that Glen Covert building. So the address to that building is located up there on our screen. We welcome any agencies to come, any individuals that need professional clothing to come, collect clothes for your clients, collect clothes for yourself, whoever might need this. And please collect as much as you are needing. All other remaining donations will be distributed to Abundant Life in Bloomington Normal, but also Path Homeless Services. So again, thank you everyone for your support in this initiative. It has just been really beautiful to see the community come together. All right, moving on to our next slide here. So we just want to take a moment to highlight a couple of our upcoming events. The one on the far left-hand side of your screen is our third annual family night at Grady's. So this is Grady's Fun Park in Bloomington Normal, completely free, but registration is required. The date for that is June 23rd at 6 p.m. with our rain date being June 30th. So spots are filling up rather quickly. So please feel free to continue spreading the word. And then once that RSVP kind of hits a max, then no more RSVPs will be able to be accepted at that time. So please continue promoting the word where it's appropriate. We would love to see many of you there. Secondly, we will be hosting a McLean County ROSC appreciation event. This will be an open house on June 8th from 2 to 4 p.m. at our Crossroads location. So really just a couple hours to say thank you again for all of the wonderful work that each and every one of you do and for your involvement with our ROSC Council. There'll be some light refreshments, an opportunity for some networking, connecting with our staff, but also an opportunity to highlight some of the fantastic work that our ROSC Council has done this last fiscal year. And that third thing that you see on the screen, that is our McLean County ROSC newsletter that was recently sent out about a week ago. So just highlighting a couple of our other sober social events. We had a very successful bowling night, and some of the fun moments from that night are highlighted within the newsletter. But we also had 3 different Tai Chi classes that were offered for free and open to the community. So if you haven't done so already, I encourage each of you to take a look at that newsletter and check out all of the wonderful work that's been going on the last couple months. Alrighty, so for the remainder part of our time today, we really just want to take a time to hear from you. Any program updates that maybe you have, any upcoming events, areas for support or collaboration. If you have any questions or training needs, we are here to help support with that as well. So I will kind of open up the floor to anyone who wants to provide updates at this time, and we'd love to hear what you have to say. Anyone?
I'll go.
Perfect. Thanks, Michelle.
This is Michelle at the Bloomington Public Library. We are in the middle of big construction, but we are, as usual, going to start our summer reading program that we'll have starting at the end of May, right after Labor Day. And so that's for all ages. Nothing says sober recreation like summer reading. So come and everybody can join in.
Wonderful. Thank you so much, Michelle.
Kari, this is Faye.
Hi, Bailey. How are you?
I am good. For some reasons, my video isn't working. Anyway, I'd like to give an update on the Extraordinary Women. Our next quarter nomination will end next month, June 15. We're looking for more nominations from the community and also, from ROSC. Thank you.
Wonderful. Thank you so much, Bailey.
You're welcome.
I'm seeing some different updates coming through in the chat here. Prairie Legal Services at Woodhill Towers, twice a week to provide free of charge legal services for anyone that is in need. Awesome. Thank you so much, Lakeisha, for providing that. What other updates do folks have and want to share today? We will be sending out the flyer for Grady's, so you guys will have that available to you, and the QR code is on that, but we're welcome to send the link to the QR code too, if that's best. Alrighty, any other thoughts, questions, concerns before we wrap up our time today?
I have another, Kari.
Yes.
I just want to plug in that Habitat for Humanity has 5 houses being constructed this season. And that's, I think, a very nice opportunity for support and collaboration from ROSC. Every Saturday from 8 to noon, it's open for volunteers to, to help with the building. The last house that will be built, not the last house, I mean the wall build for the 5th house will be this Saturday at St. Patrick of Myrna parking lot. There's a free sausage and pancake breakfast before the building starts. And then groundbreaking at the property site at 703 West Locust. It's a very moving experience that I think, the community will benefit a lot from. And it also, I think, opens up, for housing opportunities for ROSC, members.
Wonderful. Thank you for providing that information, Bailey. If you don't mind emailing me some of that information too, and we can send it out to the council.
Okay, wonderful. I will. Thank
Okay,
you.
thank you.
And can I just give a shout out? This is Michelle again. That the house that's being built, groundbreaking this Saturday is the Hero House. And the hero that was chosen is Bailey Sebastian.
Oh,
Wonderful.
wonderful.
It's not her home, it's just kind of in her honor.
Thank you for sharing that, Michelle. That's absolutely fantastic, Bailey, and very well.
Thank you.
Mhm. Awesome. Hey, Lakeisha, if you're able to put in the chat what specific days of the weeks you're at Woodhill Towers, that would be greatly appreciated. Sarah just had a quick question around that. And Joanne, I see your hand raised.
Yeah, can you hear me?
Yes, we can hear you.
I'm like forever muted and just like having people read my lips in these meetings. But no, just like some news from the state. I'm really excited. We're finalizing everything for fiscal year 24, so we're having some new ROSC coming on board. And I know that DeWitt County is like your neighboring county, correct?
Correct.
So we're gonna be having a new ROSC in DeWitt County, so I'm excited about that. And then look forward to linking you guys all together so you guys can collaborate and work together. So that's just really exciting. Yeah, we have, I think as of now, we have 56 counties in the state of Illinois covered with ROSC, which is really, really exciting out of the 102 counties. So we're looking at expanding, and I know we are set up in a cohort model where it's just once a year that we're actually doing these, giving out these fundings and stuff like that, these funding opportunities, but just exciting to see some new folks come on board. So yeah, I just wanted to share that with you guys, and thank you again for inviting me to your meeting. I truly enjoyed it, and you will be seeing me just pop up, and I love to hear the cool stuff that you guys are doing. So just wanted to say thank you.
Awesome. Thank you, Joanna. It's a pleasure to have you on today. We really appreciate your support and your time. So thank you for providing that update. There is some really great work happening in DeWitt County, so we're excited to bring them on and help support where we can too as a ROSC Council in McLean. Wonderful. All righty. Any other thoughts, questions, updates, concerns before we end our time? Okay. Well, just to put a little plug about our next meeting and some contact information, we will be meeting next on Tuesday, June 20th at 3:30 p.m. via Zoom. And if you don't already have the contact information, it's right there in front of you. You're always more than welcome to reach out to myself, Kat, Barb, or our generic McLean County ROSC Gmail account as well. So the door is always open. If you need any additional support or have any questions, we're here to help. But in the meantime, we hope to see many of you at our June appreciation event and our Grady's event, if not our next ROSC Council meeting. So thank you for joining us today. I'm sure we will be in touch soon via email with some other updates. So thank you for your time, and I will give you about 11 minutes of your day back. So you guys enjoy the rest of your day. All right.
Thanks,
Take care.
Kari.
Thank you.
Thank you.
Thank you.